Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Endometrial intraepithelial neoplasia. Endometrial intraepithelial neoplasia can be simple or complex. Simple endometrial intraepithelial neoplasia has 8% chance of malignancy, whereas complex endometrial intraepithelial neoplasia has 30% chance of malignancy. The next step of management is fractional curettage and hysteroscopy. If endometrial carcinoma is ruled out, then management is transabdominal hysterectomy. Transabdominal hysterectomy is also known as type 1 hysterectomy or simple hysterectomy. If the age is less than 45 years, then we can do bilateral salpingo-oophorectomy is not done. If age is less than 40 years, bilateral salpingo-oophorectomy is not done. But if age is more than 45 years, then we can do type 1 hysterectomy with bilateral salpingo-oophorectomy. If the patient refuses hysterectomy, then progesterone, which is megestrol or Mirena, can be given. After 3 to 6 months, endometrial biopsy is repeated. Treatment failure. In treatment failure, the disease does not resolve even after 9 months, then we call it as treatment failure. In the cases of treatment failure, the treatment is transabdominal hysterectomy. Endo
thank you and thank you for watching.